Okay, so we are going to do the electrocardiogram setup demonstration for the Clinical Experience 2 Lab Practical Final Exam. This is Lydia, and I'm going to try and do this to the best of my ability with these supplies. So when doing this, you always want to, or when doing any treatment or procedure, you want to gather your supplies before your patient is even with you, just to make sure you're prepared. So for this, you're going to want a quiet, calm environment. For doing electrocardiograms, you always want your patient to be quiet, calm, and as still as possible, because you are measuring electrical currents within the heart, and heart rate and heart rhythm. So anything that can alter that result is pretty important, so you want to maintain a quiet and calm environment at all times as much as you can during this. So next to a quiet and calm environment, you obviously want your ECG reader, and that's going to be at either 50 millimeter per second paper speed or 25 millimeter per second paper speed, and then it's going to be 10 millimeter per MV calibration. And so then you're also going to have your wires, which is connected to your reader, and then you're going to have an alligator clamp that connects to your patient. And these 4 wires all have different colors. There's black and red, and then there's white and green. And those all go on the 4 different limbs of your patient. So the black goes on the left front, the red goes on the left hind, the white goes on the right front, and the green goes on the right hind. And so you also want conduction gel or isopropyl alcohol for this, and that acts as a conductive agent for the electrical current. So conduction gel is the better of the two because you're working with an electrical current. Adding alcohol to that could risk hazard of a fire, so we might want to not use that. Conduction gel probably better. So then you're ready to start pretty much, and so you always want to read your patient, make sure that they're calm, and that they're as less stressed out as they can, especially during an ECG. You don't want heart rate to be increased when its normal rate is lower than that. Again, that can alter the results. So flipping around to my little guy here. So like I said, we're going to attach our alligator clamps, and we're going to do so how I'm going to demonstrate. So your alligator clamps on your front limbs are going to go distal to the elbow. The alligator clamps that we're applying to the hind limbs are going to go distal to the stifle. So any wire with the alligator clamps going to the front limbs, distal to the elbow, and then on the hind limbs, distal to the stifle. So once you have your wires on your patient, you can then apply your conduction gel. And a small amount goes a long ways. You just want to put a little bit on each alligator clamp where it's attached to your patient, so on each 4 of the limbs. And then so you can turn your reader on at this point and have it read for 30 to 60 seconds. Once you think you've gotten a good reading, you can turn your machine off, take the clamps off your patient, wipe the gel off. That's always a good idea to clean your patient up so they're not sticky when you bring them back to mom or dad. And you want to read have the doctor read your ECG, and then your patient should be all done with that procedure. So I want to mention that if you have a patient that you think you might want to use sedation to do this because they're bad or they just don't tolerate that type of procedure, that's not a good idea because that can alter the results of this procedure significantly. So sedation is not really an option for this type of procedure. They need to be in the most normal state as possible to have this done to get a good accurate reading. All right.